I was recently seen in the South Austin ER for chest pain. Thankfully, it turned out to be an easily treatable condition and not as serious as I'd feared. It was, however, a very difficult
In September,
and
I was admitted to your
scary
hospital for a stay of 15 days. This was my second admission this year. Both times, I was a
My
patient
husband
on
was
Street
recently a
Central.
patient at South Austin Hospital, and I want you to know about the excellent care he received throughout
Our
your
brother was
hospital.
a patient at your hospital, a cancer patient of Dr. Myers, in the ICU department, the IMC department, and
I've
the
spent a
PCU.
great deal of time in emergency rooms over the years, usually as an employee. I was impressed with the level of courtesy, professionalism, and promptness displayed by everyone
I am very
encountered.
pleased with the care I was given and the friendliness and professionalism of the staff. They were patient and did not seem rushed. They spent time explaining
He
my
stayed
medicines
2 days in
and
the
just
ER,
visiting.
2 nights in the IMC, and a day and a night on the 4th floor.
Our parents taught us that we were to take care of each other, and that lesson extended into adulthood. We made daily visits, sometimes twice or 3 times a day, usually hours on end.
This was one of the best stays I have had in your hospital, and I will certainly come back to South Austin if the need arises.
I was seen immediately, treated with the utmost respect and compassion. Everyone who entered the room verified my ID. I was frankly quite impressed.
The personal attention that was given to our brother was wonderful. He gave your nurses a hard time. He loved life, and being a patient stifled those feelings.
The competence we found was throughout the hospital in the nursing, technicians, and other staff. Whatever South Austin is doing, it is getting results.
The emergency department is a very taxing place to work, and I know that sometimes the public does not see the very best side of the department or the employees. I
We
did.
wanted to stay longer than allowed. Your nurses would find ways to accommodate us and yet abide by all the rules.
We are aware of the shortage of good nurses and the problems this causes in hospitals. It would appear that South Austin has a formula for attracting and keeping the best.
One tech I especially want to recognize was named Josh. Even if he was not working my end of the hall, he would stop in and see if I needed anything. He is very proficient and caring.
Alas, God has other plans. Our brother's last days were as good as we could have hoped for, and he was not suffering when he left us.
Please convey our appreciation for the competence we saw in your nursing and other medical staff.
Due to the support of your wonderful nurses, this tragedy did not leave us bitter.
There are others whose names I don't remember, but I would like to compliment the whole 3C staff.
Those wonderful men and women know who they are, and your hospital should be proud to have such caring nurses.